Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.
You're listening to Healthcare Matters, the podcast that pulls back the curtain to help you make sense of complex healthcare economics and policy issues. With us, as always, is Dr. Robert Popovian, joining us from our nation's capital. He's a pharmacist, he's an economist, and he's Chief Science Policy Officer at the Global Healthy Living Foundation.
And joining me is my good friend, as always, Connor Mertens in Seattle, my co-host and our patient advocate and community outreach manager. And Connor, before we get started, these are heady times in the state of Washington. The Huskies and the Cougars are undefeated, and I've circled October 8 in my calendar where Cougs are going to visit Coliseum, and you and I are going to have probably some side conversations on that.
You better watch out. The Cougs are making a run for it this year. I'm not used to us having a good football team, so I'm really kind of just holding my breath until the other shoe drops. Well, thanks for listening to us. We received some great feedback on our last episode, the Inflation Reduction Act, the good, the bad, and the ugly. What's in it for patients? It seems like it really touched a hot topic. Make sure you have to listen if you've missed it.
So keep the feedback coming and make sure you spread the word by rating our podcast or writing a positive review. We always appreciate those. Now let's get into this week's episode. Connor, does the number 92% mean anything to you?
Let's see here, 92%. That's the amount of Seattle homeowners that also own a dog and a Tesla.
Well, no, 92% is actually the percentage of prescriptions in the United States that are filled as generics. So 8% of prescriptions in the United States when you go to a pharmacy and you receive your drug are brand name medicines, and 92% of the time those prescriptions are generic formulation. So today, Connor, we'll be talking about why are our patients overpaying for their generics. Remember, generics are supposed to be very low-cost alternatives to brand name medicines. But you'll be surprised to hear what's going on here. And I know you have a personal example that has happened to you recently when you went to a pharmacy to pick up a prescription for your father.
Well, we're going to be talking about out-of-pocket costs then, it sounds like. And like you mentioned, I went to the pharmacy recently, casual day, pick up a prescription for my dad, and that copay was ridiculously expensive. And I was pretty lucky that the pharmacist actually went out of their way to offer me to pay for it in cash, and it was wildly cheaper. Robert, isn't the entire point of insurance to lower healthcare costs? How often is this the case that medications can be cheaper paying for it in cash rather than through my insurance?
Well, more often than you think, and this is why there's been an uptick of individuals who are bypassing insurance and actually paying for their prescription drugs and sometimes for their healthcare expenses in cash rather than using their insurance model. You know, I was on a call, Connor, recently with a friend of mine who owns 2 pharmacies in a state of Ohio. He has his traditional pharmacy where they take insurance, you know, where you go in and you pick up a prescription, you use your insurance card, you pay a copay, a co-insurance, or a deductible. And right next door, he has a pharmacy specifically just for cash paying patients. So that pharmacy does not take any insurance, any type of third-party insurance, and all they offer is patients to pay in cash. And he recently gave me an example of a patient that walked into his pharmacy. This patient was going to get a 90-day supply of a medicine, and his exact copay was going to be $56.87. Well, this pharmacist said, look, I don't want to tell you what to do, but this is your copay based on your insurance design. But if you want to pay it in cash, right next door is our other pharmacy that offers the same medicine at the same quantity, same drug at a cash price. And guess what the cash price was? It was $14.75, significantly lower than he would have paid if he had used his insurance.
I think that the front and center question then, Robert, becomes why? Why is it that paying for cash is cheaper sometimes than, using our insurance, which is designed to make healthcare costs cheaper?
So Connor, the reason this happens is because of a term called spread pricing. Spread pricing is a phenomenon that generally happens in the generic space. And this is when an insurance company charges an employer significantly more than what they reimburse a pharmacy, and they keep the spread as a benefit or a profit. The pharmacy benefit management company or insurance company keeps that as a benefit or a profit to themselves. Because of this reason, and because outpatient costs for patients, such as a deductible, coinsurance, or copayment, is due to the inflated numbers, patients end up paying significantly more most often in the generic space.
And how often would you say that this is happening to individual patients versus government entities or employers or other people of that nature?
That's a great question. So, as always, we refer back to published information, right? Because this is a podcast that we try to talk about policy issues, but with facts to help patients understand where these things are coming from. So, there are two studies that were published by the University of Southern California, the Schaeffer Institute. The first study looked at how often do patients overpay when they walk into a pharmacy for a generic medicine if they use their insurance card versus if they had paid it in cash. And what they found out in a 1-year period looking at data, that patients over 25% of the time when they were acquiring a medicine, and even a little bit higher when they were acquiring a generic medicine, were overpaying if they used their insurance card versus that they have paid in cash. So in other words, their copay, their deductible, or their coinsurance would have been significantly higher than if they would have just paid it in cash. Now, move forward, how often and by how much does the government overpay or the employers overpay? Well, there's a second study that Schaeffer did utilizing Costco. And in that case, what they did is to compare how much does the federal government would have paid if they would have paid the cash prices by Costco versus how much did they reimburse the insurance companies for that same prescription. Same volume, same drugs, same amount dispensed. And what they found out is that over a 2-year period, the Medicare program overpaid by $4.5 billion. So in other words, it would have been cheaper for the federal program to have acquired these medicines through cash at Costco and just provided all the Medicare patients with Costco benefits, and this had to do with the top 200 generics, than to go through the insurance model that currently exists. What happens to that $4.5 billion? That's pure profit for the PBMs and the insurers.
Just to refresh our memory, the PBMs, these pharmacy benefit managers, can you remind us what they are or why they exist besides to frustrate us as policy experts?
Pharmacy benefit management companies are really middlemen. They're not payers. Insurers and pharmacy benefit managers are not payers. The two payers in the healthcare system in the United States are patients, our employers, and to a certain extent is the federal government and the state governments. Although you can argue that ultimately we pay for that too because they tax us for those benefits. So it's really the consumer, the patient, and the employer because they subsidize most of it. So what the pharmacy benefit managers do, they manage the benefit for the pharmacy, but they have corrupted it so much to a point that many times, and it's not very few people, patients end up overpaying for their prescription drugs when they're using their pharmacy benefit rather than if they had paid it in cash. And if you think about it, this goes against the whole premise of insurance, right? The whole premise of having insurance is to get the best deal. Then if you're not getting the best deal, then what is the point of insurance?
And there just seems to be so many intermediaries that patients have to go through when trying to get their medications. And everyone's got their hand in the pot and everyone wants a little bit of that money that's coming in.
That is absolutely true. And there's many more intermediaries than just the insurance companies and the pharmacy benefit management companies. But if you think about it, for the lion's share of what gets captured in the middleman territory, the lion's share goes to those two entities, the PBMs and the insurers. The rest of it gets divvied up, a very small percentage gets divvied up between hospitals, physicians, pharmacies, wholesalers, and other entities that exist.
It just all sounds so confusing, to be honest, Robert, and I'm supposed to be, like I said, I'm supposed to be an expert at this, but what can folks do when buying medicine to help lower those costs? What should they be thinking about?
And I wouldn't say just medicines. And Connor, I'll give you my personal example, just like it happened to you with Dad's prescription. So my daughter, and it had nothing to do with prescription drug, my daughter required a MRI. So she went through the insurance first. She called the MRI center that she was referred to, and her out-of-pocket cost with insurance would have been $500. So if you utilize the insurance that we currently have, we would have had to pay $500 out of pocket for an MRI. I told her, why don't you call different MRI centers and also call back the same one you were referred to and say, I have no insurance. How much is this going to be if I paid for it in cash? Well, the cash price ranged between $300 and $350. In other words, it would have been cheaper for her to get cash price than would have gone through the insurance and used the insurance, she would have overpaid between $200 to $150.
I think another really good piece of advice is, and you'll love this as a pharmacist, is talk to your pharmacist. One of the easiest questions you can ask is the one that I asked, which is this the best price for my medicine? Is there generic or lower cost options? There are so many ways to find cheaper medications now as more of these cash systems are being introduced into the market.
You're absolutely correct. And as patients, this is the thing that I would say to you, Connor. We need to become better consumers of healthcare. We are patients, but we need to become also consumers. Just like the way we consume anything, we need to become better at it. And we need to ask questions. And my tip really is, if a patient is looking, the first thing they should do if they have a prescription in their hand and it's for a generic is to look up what that cash price would be if they went to Costco or Walmart or Amazon or Ro.com, any of these pharmacies, and figure that out first before they go to the pharmacy and actually try to use their insurance to pay for that prescription. So that would be my ultimate tip. The same thing that I did with my daughter, to say, before we go through this road of using our insurance to pay for the MRI, why don't you call around for a couple of other places, including the same place you were referred to, and get the cash price for that MRI. So as patients, we need to become better consumers.
I think that patients in America are forced to become better consumers because they're living in such a convoluted and complex healthcare system. But, one of the other questions that I think that we like to address here is what, if anything, is being done about this legislatively or in government. I think that I saw something about the FTC, Federal Trade Commission, is stepping up and finally looking into these practices, these PBMs.
FTC is certainly looking into this, and this is a bipartisan effort by the FTC. All the commissioners voted in favor of looking at how does this impact out-of-pocket costs for patients for prescription drugs and some of the practices that the PBMs get involved in. But more importantly, just this week, it was announced that Centene, an insurer, has settled with the state of Texas for over $100 million in fines because the state of Texas proved that Centene overcharged them for the prescriptions. Now, this is not the only settlement. Other states have settled as well with the same insurer. State of Ohio did it, I believe, last year or earlier this year. They settled on that. Multiple state lawsuits are going on. So there's a trend here where insurers and the pharmacy benefit management companies that are hired by these insurers are being held accountable by the state governments. But you're absolutely right. We need to be better consumers, and we need federal agencies like the FTC to really take a closer look at some of these practices because they are truly hurting patients. And Connor, we need to make sure that this information gets conveyed back to our patients at Global Healthy Living Foundation.
Well, as always, Robert, I want to make sure you get the last word in here. But when I think about our discussion, what it really boils down to is Americans are paying way too much for generic drugs due to a payment system that is manipulated by the pharmacy benefit managers. How'd I do on that?
You are correct. It's unfortunate that a promise of generics is being undermined by the pharmacy benefit management companies. And I would say, Connor, we talk a lot here in this podcast about brand name drugs, rebates. Why aren't patients getting the benefit of the rebates at the point of sale? We, in fact, talked about it in our last podcast. The truth is about the rebates, and this is something that we mentioned earlier on in our podcast, is that rebates affect about 8% of the prescriptions. Those are brand name prescriptions. Not a lot of people take those medicines. We talked about how 92% of prescriptions in the United States are generics that are filled. And in fact, the percentage is even higher if a generic is available for a brand name drug. So to me, whether or not patients get the benefit of the rebate contracting and the negotiated prices on the brand name medicines is important, and it impacts patients, and we need to address that. And as GHLF, we are addressing that issue. But to me, the generic issue and the overpayment for generics by patients is far more nefarious, because what this practice does is directly impacts patients overpaying out of pocket. And yes, the dollar amounts are not equal to the brand name drugs. The numbers are small, but because the volume is so high, there's more exposure to patients to overpay because of these type of practices for their generic medicines. And remember, all of us take generic medicines. Not all of us take brand name medicines. So therefore, it is even more important for patients to be better consumers in that space. And as we said, we need to start taking charge And whenever we have a question, ask your pharmacist, or better yet, before you even walk to a pharmacy, look up those cash prices at those entities that we mentioned. Costco.com provides this for free of charge on their website. You can go to Walmart, Amazon, any of those websites, and get that information before you walk into a pharmacy and figure out what that payment would be if you used your insurance card.
Well, as always, Robert, that was thorough. Thanks for breaking it down for us. I think there's some very valuable information for our listeners. Don't forget to subscribe to our podcasts on Apple, Spotify, or wherever you may be listening, so you never miss an episode. And if you have a second, help spread the word by rating our podcasts, writing a positive review, and sharing with your friends and family. It'll help more people like you find us.
You can also send us an email or an audio clip to healthcarematters@ghlf.org. Our producer Ben is always looking for those so we can improve the production of our podcast. And guess what? He may decide to feature you in one of our upcoming episodes. And before we go, make sure you all also listen to some of our great other podcasts that are on the GHLF Podcast Network.
That's a great point, Robert. We got a lot of really good podcasts in our network. Our friends and colleagues, Stephen Newmark and Zoe Rothblatt, are back with Season 5 of The Health Advocates. In the most recent episodes, you'll get a full update on where we're at with COVID, methotrexate access issues, as well as a great conversation about IBD. It's a very informational podcast, so make sure to go and give them a listen. And remember, you can find all of GHLF podcasts at ghlf.org/listen. As always, he's Dr. Robert Popovian.
And he's Connor Mertens, the gentleman who talks to patients. We'll see you all next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.